disappointed, very disappointed when Governor Haslam said no to the Medicaid expansion, no to accepting $1 billion of our own tax money back each year starting January 1, 2014 to provide for these medical needs. Now the governor says he has a plan. He says, no, but I have a plan. But we want something in place for January 1, 2014. Yes. Yes. Why don't we do our plan?
Life that you intend. Forgive us for hearts that have been slow to feel another's pain, for hands that have been still when caring touch was needed.
That's not where you deliver primary care. Over and over I'd see someone, chest pain, you need a test. They'd come in, they were weak, losing weight, you need a test. Can't pay for it, doc, I sent him out. No doctor to send him to. Young man, 46, his dad died at 54 with a heart attack. He was 46 years old, having chest pain, working full-time, minimum wage, no health insurance. He deserved health care and the tests.
Yes.
Prevent the heart attack. Don't put him on disability with the heart attack. We need this now. Not in 2015, not in 2016.
Yes.
Got some chants for you, and on the back is Governor Haslam's phone call. Let's be sure and call him today and say, we want him now. And you'll see why I went into medicine and not poetry. But please, Governor Gill, show that you will. Show that you care. Expand health care. Show that you care. Expand health care. Please, Governor Gill, show that you will. Bring down millions. It means billions. Bring down millions. It means billions. We really care. We want health care. We really care. We want health care. Return tax dollars to our own hollers. Return tax dollars to our own hollers. And I want to do it one more time. Yes, sure. Please, Governor Gill, show that you will. Show that you care. Expand health care. Show that you care. Expand health care. Please, Governor Bill, show that you will. Bring down millions. It means billions. Bring down millions. It means billions. We really care. We want health care. We really care. We want health care. Return tax dollars to our own hollers. Return tax dollars to our own hollers. And did you know that health care and social services is the #1 employer in the state of Tennessee? Over 12% of our jobs. And he's going to hurt that #1 employer and drive up unemployment in all the counties, urban or rural. We want it now.
What's going to happen to the hospital? Lies for these kind of patients, for my patients. Because any one of us could be these patients one of those days. If we lose a job, if we lose our insurance, we're just not far removed from these patients I see. So we have a once-in-a-generation opportunity to not just help 1 or 2 people like I do, but to help hundreds of thousands of people, up to 300,000 people with what's going on now. Now, I'm not a health policy expert or an economist, but this is a unique window of opportunity that I don't want to miss out on speaking up for my patients, for advocating for people who can't advocate for themselves. I appreciate the opportunity to speak here, and I hope we can all reach an agreement that this is the best path forward to help all of us in the future, is to cover as many people as possible with health insurance.
I'm 61 years old. About 7 years ago, I became seriously ill and working without health insurance. About a year ago, I finally got enough money to go to a doctor because I was having a lot of problems. And he examined me. He said, well, you need surgery. And the thing that I needed surgery was, it wasn't a major thing. It was a minor thing that thousands and thousands and thousands of people deal with. And I asked him, I said, well, what happened if I don't have surgery, what is the other treatment? He said, you don't understand, there is no other treatment. Well, what's going to happen is this, at some point in time, this condition, although with care it's not a serious thing, without care it's a very serious thing. You're going to end up in the ER. If you get there fast enough and everything goes well, hopefully you'll have just some permanent damage. So what happens if I don't get there in time? He said, well, then there's a chance that you'll die. About 4 months ago, I found out that I had lost about 40 to 50% of the strength in my right arm. My wife kept on bugging me. She said, go to the doctor, go to the doctor, go to the doctor. I said, I don't have any money to go to the doctor. I can't go to the doctor. Finally, after a couple of weeks, I went to the doctor. And he said, look, I've got probably not really good news for you. I said, what's the news? He said, I think you've had a stroke. And he said, here's the test that we need to do to find out exactly what's happened, where it's happened, and what needs to happen next. And I said, well, I can't pay for those tests. Those tests are not going to happen. So basically, he's taking his guess. He's given medication based on the assumption of what he thinks happened. Ended up going to the ER. Found out that I had a bill for $1,600. That if I went to a doctor, it wouldn't be anywhere close to $1,600. I'm a lot luckier than other people. I don't have cancer. I don't have a whole lot of other things. I don't have health care. The job got to the point where it became harder and harder and harder for me to do it and do it for real. About a week ago, I sat and I talked with my wife. She said, you know, I think this job is killing you. You need to stop. The problems that I've had are preventable. Nothing. After a lot of prayer and a lot of soul searching, I ended up resigning from my job. I really hope there is a Tennessee plan because people in Tennessee certainly need a Tennessee plan.
That's right.
Let's also take a moment to hold in our minds and hearts the healthcare workers and hospitals who want to provide this care, whose jobs may be threatened by the lack of this money. Life that you intend. Forgive us for hearts that have been slow to feel another's pain, for hands that have been still when caring touch was needed.